So let's do part 2 of our blood notes. So for our testing that we're going to do for blood, you can sometimes get sent to get a complete blood count or a CBC. And you'll hear it a lot of times on the doctor shows. They'll go, oh, I need a CBC. This is a fairly common test, and what they're doing is they're removing about 20 milliliters of blood, and they are literally going to count with the aid of some equipment. Sometimes they use a computer, other times they just do it under a microscope. They're going to look to see if the blood cells are within normal limits. We already talked about how many red blood cells and white blood cells and platelets you should have per millimeter cubed. So you want to make sure those numbers are within a certain range. You don't want them too high and you don't want them too low. You want them to be just right. So we're going to count our red blood cells, our white blood cells, and our platelets. So this is kind of what one of the reports is going to look like. I just took this off the internet, and on here you're going to see this has way more information than I needed to take. It just was kind of neat because it was already set up. So this is going to show you what they're counting. So here we've got, they're looking at the white blood cells, they're looking at the red blood cells, and then they're looking down. Here's your platelets here. Here's your neutrophils, your lymph nodes, your lymphocytes, your monocytes, your eosinophils, and your basophils. Now it will also tell you whether or not the amount that they get is within normal. So they'll give you the number for the patient, how many cells per millimeter cube that they end up with. Oh, they've done a per liter, but it doesn't matter anyway. So they're going to give you the count, and then also beside it, it'll tell you if it's abnormal or not. And next to it, so you don't have to memorize all these things, they're going to tell you what the normal numbers are. So you can take a peek at that, say, oh my gosh, 111. That's normal. It should be 115 to 165, so you can have an indication. Now when this comes up on the computer, a lot of times anything that's abnormal is highlighted in red, so it makes it really easy for the nurse or the doctor or whoever to take a really quick look at this. So if they find that there's a problem with the CBC, what they may send you for is a blood smear. And a blood smear, again, really easy. They're going to just take a little bit of your blood, smeared onto a slide, like those slides that we use for microscopes, and then examine the cells. So usually this is done after there's an unusual CBC count. So if they notice that the cells kind of look abnormal, they'll send you for a blood smear, or they'll use the blood and do a blood smear. And what they can do is they can kind of see some types of conditions that affect blood cells. They can kind of get an idea of what type of conditions affect blood cells. Now in class we would be using pre-made blood smears to look at under the microscope. If you get the opportunity to make them while you're in college, university, whatever it is, basically what you're doing is you're putting a drop of blood onto a slide, and then you're smearing another slide across the top of it. And there really is an art to it, because you want to be able to get the blood cells in a single layer and spread out enough that you can look at them really carefully and not having them all on top of each other. So if you get a chance to do that, give it a try. We've tried to do it with fake blood in class. It doesn't work very well, but it kind of gives you an idea of how to do the smear. Alrighty, so here's what we would see under a normal blood smear. So you would just see, again, this is what you want to get. If you've done a good blood smear, you'll get the cells basically spread out nicely. You're going to see red blood cells that look, a little bit darker on the outside, lighter on the inside. You're going to see these little dots here. These are the platelets. You want to see a nice number of platelets in there. And you're probably going to see some neutrophils. You want to see some neutrophils because they're kind of like your beat cops. They're kind of going around and making sure that everything's okay. You may see a lymphocyte in there as well. That's okay too. You just don't want to see a whole lot of neutrophils. You don't want to see a whole lot of any type of white blood cells out of normal. Well, if you do and you're sick, you know why you see them. But, if you're feeling just fine, you have a whole pile of white blood cells, you might be a little bit concerned. So if you are deficient in iron, so if you have iron deficiency anemia, which most females have, if you were looking at the red blood cells under a microscope, they would seem small and pale compared to normal. Now, I don't have a normal one up here for you to compare to, but these guys come up a lot paler, and they would be smaller under a microscope compared to a normal blood smear. So with this, you may be prescribed iron. They would also do, when they do that CBC, they would do a look at your ferritin that was on that sheet too, to just see how much iron is in your blood, and probably recommend you take some iron or eat a nice big juicy steak once a week as well. The next one you can look for is acute lymphatic leukemia, or short formed as ALL. So here what we have is we have an increased number of lymphocytes. And you might think, well, it's great having more lymphocytes because we have more white blood cells, we can kill things off. But again, with anything that's cancer, the cells grow all abnormal. So the cells, these are lymphocytes, they're not even nice looking lymphocytes. They don't have very much cytoplasm around there. Their nucleus is way bigger than normal. They're oddly shaped. There's far too many of them in the bloodstream here, or in the blood smear. Another one is infectious mononucleosis. So this is a herpes virus that will cause this. It happens a lot of times in teenagers, but it can happen at any age. It just seems that teenagers are doing things where they're going to be spreading a lot of saliva. So they may be sharing drinks, or I don't know, people in class, are not you guys so much, but I always see kids going, oh, can I have a sip of your pop or whatever it is? And I'm like, oh my God, don't touch that. Sometimes you're going to be like a high fever. You're going to have swollen lymph nodes, a sore throat, and fatigue that is beyond just being tired. Like fatigue where you can't, you have to brush your hair. You can't even like lift the brush, kind of a thing. Usually mono lasts about 1 to 2 months, and you really, really do have to be very, very careful if you have mono. Sometimes people say they have mono, they don't really have mono, but if you've been told that you have mono by a healthcare professional, you really have to take it easy, because you can end up with an enlarged spleen, and that's one of those things that you can rupture. It's very, very rare, but you do want to take it easy so that you don't end up, dying of that. This is also called the kissing disease because it can be passed on through kissing. And you'll see here we have abnormal looking lymphocytes. Now the next one is sickle cell anemia. Now this is genetic illness that tends to run in people of African descent. So what happens here is the RBCs, or the red blood cells, have a bent shape or a sickle shape. Someone's going by in a boat, if you can hear that. So what ends up happening is the hemoglobin is actually distorted. There's a change in the protein sequence, or the amino acid sequence of the protein that makes up hemoglobin, and that gives the red blood cells a bent shape. Now, scientists think this happened as a way to defend the people's bodies against the malaria parasite. So it helps them, not get sick from malaria, but the bent sickle cell blood cells can cause them to have their own crisis. So you can see here they have this sickle cell, this bent this crescent shape kind of look to them. And remember, those little hooky round things can get stuck in little bends in the like in the elbows or the knees and cause some clotting, and that's like they go into sickle cell crisis, where they have the blood is actually blocked from certain limbs because they've got the blood clots around the joints. And if it's not treated, they can die in about 10 to 20 days. I remember growing up in Windsor, because Detroit was right across. Detroit has a high, and still does have a high African American population, and I remember, because we always had American television, I remember they always had these commercials on to go get free sickle cell testing. I never understood what that meant, and then I did when I got older. It was kind of cool. Not cool for them, but just kind of an interesting little sciencey thing. If you have an allergic reaction, so sometimes, so say you've been say you've been bit by a tick. You've got a tick. All right, so you're going to launch an inflammatory response to that tick. If you were able to take out some of the fluid that's around that tick bite, you would see there's an increased number of basophils. So basophils here, remember we said they're so covered in granules that it's really, really hard to see the nucleus. Here's the neutrophil here, just cooling around there, and there's a lymphocyte, normal lymphocyte there, got a couple little platelets in there as well. There's a little platelet there. Here's our normal red blood cells. So if an increased number of basophils is going to show that you're having an allergic reaction to something. All right, and these guys contain histamines, so they're going to release their histamines to try to increase blood flow to the area as well. Okay, so that's basically the only blood test things that you need to know. Just make sure you know what those blood smears look like, because they're going to be on the quiz, or maybe not all of them, but some of them. And so let's look at the uses of donated blood. So donating blood is really, really important. So what do we use donated blood for? Some people can't donate blood. They've got different conditions that they're not able to, or they're not allowed to because they've traveled to certain countries, or they're sick so they can't donate it. So it's really important for all those people who can donate blood to donate blood while they can. Now, we rarely use whole blood, so they would be used in emergency and trauma, but not very often. So if there's a big car crash, they may use whole blood, just really, really quickly. But basically what they do is they separate that blood into the components, and they use the components of blood. So if they take a unit of blood, it's about 450 milliliters, so about half a milk bag of blood. So what do they use the RBCs for? So they're going to, basically what they do is they separate all these things out. They throw the white blood cells out. Like, they don't need neutrophils and all that kind of stuff. They just toss those. But the red blood cells, if they're stored, can be stored up to 42 days. They would need refrigeration. And they would be used for things like cancer and blood diseases. So when you're getting chemotherapy, you're wiping out literally, all depends on the type of chemotherapy, but you're literally wiping out your bone marrow. So there comes a time where you may become anemic, and not due to diet, due to actually not making any red blood cells. So they could give you red blood cells to try to bring your red blood cell count up. Used in surgery sometimes, if you're going for surgery like hip surgery, you can go a couple weeks before, donate your own blood, that gets stored for you, and then they can use the blood afterwards if you've had surgery. For obstetrics, so after moms have given babies, if they need infusion of red blood cells because they've lost a lot of blood while they've been given blood. Here's orthopedic surgery again, which is different type of surgery. And anemia not related to diet. So this is anemia that isn't easily treated with iron supplements or eating meat. The plasma here. So the plasma can be frozen and stored for up to 12 months. So they can have a nice supply of plasma on hand. So this is going to be used for things like liver disease. Remember, for our plasma, we've got all those proteins in there. So people with liver disease a lot of times can't make the proteins. So what we're going to be doing is we're going to try to replace some of that volume and those proteins. Again, you can use them for certain operations. If you've lost some blood, you just need plasma. Again, cancer bone marrow therapy. So again, we're wiping out those bone marrow with chemotherapy, so we can use some of the plasma to replace that. Use it for leukemia or certain bleeding disorders. Last one is the platelets. So for the platelets, we can use them. These can only be stored for about 5 days. So if you have hemophilia where you need the platelets, it's really, really important because the person's not making platelets and they need to have their platelets replaced quite quickly, and we can't store them for as long. So they need to be donated quite often. So they're used for, again, for cancer treatments, if we've got bone marrow failure for some reason, and for people who are hemophiliac. All right, so that's it for part 2. There's a quiz on this. I'm also going to include a chart. It goes onto a legal size piece of paper, but if you don't have legal size, just sketch it out, or maybe put 2 pieces of paper together. So it's got little terms on it, and then it's got all the different types of proteins and blood cells so that you can kind of arrange it. So it's just kind of arranged a little bit nicely for future studying. Alrighty, talk to you later.